everyone, I'm Hadil and today I'm going to talk about transient tachypnea of the newborn or TTN. This is the table of contents. So TTN is a benign self-limited disease characterized by transient breathing difficulties because of the delay in clearance of fetal lung fluid. It's usually resolved by itself within the first 72 hours of life. It's most common shown in term infants after cesarean section because of the absence of vaginal squeeze, which help in the clearance of fetal lung fluid. Patients with TTN usually show signs of respiratory distress such as tachypnea, cyanosis, grunting, retraction, and nasal flaring. And when performing ABG, it usually shows mild to moderate hypoxemia, hypercapnia, and respiratory acidosis. In today's case study, we have a 32 years old gravida 2 para 1 mother with no significant medical history, delivered a 38-week gestational age male on December 1st, 2023 via cesarean section due to malpresentation. The baby showed signs of respiratory distress such as nasal flaring, intracostal retraction, tachypnea, and mild cyanosis. Therefore, we admitted the patient to neonatal intensive care unit. On our initial assessment, vital signs showed tachypnea with the respiratory rate of 75 breaths per minute and a heart rate of 150 beats per minute, which is normal, in addition to a temperature of 36.7 and a saturation of 88% on room air. On physical assessment, Apgar score was 6 at the first minute and then 9 at 5 minutes. The patient showed symmetrical chest movement and fine crackles on auscultation, which is normal, but the patient showed reduced air entry bilaterally in addition to mild use of accessory muscles. The patient's ABG showed hypercapnia in addition to mild hypoxemia. We started our intervention with oxygen therapy via nasal cannula 2 liters per minute with adjusted FiO2 to maintain saturation above 90%, but hypoxemia was still present even after oxygen therapy. Therefore, we had to level up to CPAP therapy. We started it at a pressure of 5 with FiO2 titrated to 30%. The baby's oxygenation was improved, his work of breathing was reduced, and he has stabilized ABG results. The patient was kept on CPAP for 36 hours with gradual weaning, but at the second day, he started showing worsening respiratory distress signs in addition to hypoxemia and signs of fatigue. Therefore, we had to intubate and start mechanical ventilation. The ventilator was on pressure support mode with a peak inspiratory pressure of 20 and a PEEP of 5. Within 24 hours, the patient started showing significant improvement in respiratory effort and in blood gas parameter. Therefore, we weaned the patient and extubated him and then transferred him back to CPAP. The patient was stable on CPAP with FiO2 reduced to 21% within 12 hours. At day 4, the patient was able to breathe all by his own without any signs of respiratory distress, and therefore he was discharged at December 4th, 2023. So to summarize, we had a 38-week gestational age patient who was delivered via cesarean section. The patient showed signs of respiratory distress and hypoxemia due to TTN. We provided the patient with oxygen via nasal cannula, but he still showed signs of respiratory distress. Therefore, we leveled up to CPAP. The patient was stable on CPAP for 36 hours, but after that he started showing signs of respiratory distress, hypoxemia, and fatigue. Therefore, we had to intubate the patient and mechanically ventilate the patient. Within 24 hours, the patient started showing improvement, better ABG results. Therefore, we started weaning and extubating the patient. The patient was able to breathe all by his own without any additional intervention. Therefore, he was able to be discharged after 4 days in neonatal ICU. So the rule of RT here is to help in initial assessment and monitoring of the baby, in addition to help in therapeutic interventions such as CPAP therapy, mechanical ventilation, and oxygenation. Also help in intubation, ventilators managing, and also weaning. So our take-home message here is that the cornerstone of TTN management is supportive care, which focuses on oxygen supplementation and close monitoring in most of the cases. But in moderate to severe cases, CPAP is an effective way to manage TTN. In rarely very severe cases, mechanical ventilation could be needed. It could be life-saving in cases of respiratory decompensation. That's all for today's case. Thank you so much. I'll be more than happy to answer any question. This is my reference and thank you.